reoffending throughout life, which are our life course offenders, while others only engage in crime during adolescence and then they stop, which is our adolescent limited offenders. Pretty self-explanatory. This also explains the age crime curve. So I actually wrote kind of a model for you for the age crime curve. It may be a little small, but we'll work with it. So if we have an axis, we have our y and we have our x. We have age down here, then we have our crime rate right here. If we start from age 0 and we work our way to, let's say, 40, we get this downward opening parabola. So this is our parabola, and then this is also known as a concave downward curve. So this is kind of what it looks like throughout the range of criminality. It decreases, and then it increases again, and then it decreases by age 40. It's usually opening in the teens is whenever it's the highest, teens to early 20s. Sampson's and Lobb's age-graded theory. So we talk about strong social bonds that later in life help people move away from crime, even if they had a troubled past. Again, this mostly happens whenever they're in their late 20s. They start to have that realization, okay, this is my life, I need to start moving on. Or some just commit crime and continue to commit crime. Turning points can restructure life trajectories. Life trajectories meaning life events and behaviors that form a pattern throughout life. Weak or broken bonds can increase offending likelihood, such as family, school, peers, communities, things of that sort. So, of course, with any kind of theory, we have risk factors and protective factors. Now, protective factors, we call them that instead of like positive factors, because they're not always positive, but they can help the child stop reoffending, the youth stop reoffending. So some of our risk factors include poor parenting, delinquent peers, school failures, substance abuse, and abuse in general, physical abuse, verbal abuse, things of that sort. Protective factors can include supportive adults, such as family, guardians, friends, education, stability, stable employment, and even marriage, like we talked about earlier. The ultimate highlight. So in all, life course theories highlight interactions between individual traits in our environment. And of course, with all Dr. J's class, we have a policy implication. So we start off with early intervention, which is crucial. We can also call them child prevention programs. We can focus on strengthening family and social bonds. We can focus on rehabilitation opportunities, and we can also focus on supporting reentry programs that create positive turning points for these kids. So we have some strengths and we have some weaknesses of the theory in all. Some strengths include explaining both continuity and change in criminal behavior. It combines biological, psychological, and social influences. But we do have some weaknesses that we can talk about that can be seen as weaknesses, but they're not as crucial as you would think they are. Some can be hard to measure turning points precisely, but it also may overemphasize social bonds and underplay structural inequality as well. So in all, we see crime patterns that evolve over the course of life. We see turning points that can lead to desistance, and combination of theories for understanding, such as the learning and strain theory. And then we also offer new perspectives to help rehabilitation in the youth. And I did make a timeline because I know that after talking about all this, it can be kind of difficult to understand. So in the 1950s, we talk about the longitudinal studies that were first conducted. In the 1970s and early 1980s, we talk about the life course series. Then in the 90s, the low self-control and theory chart. 1993, we have two of them, Moffat's developmental taxonomy and Sampson and Lobb's age-graded theory. And those are the references. All right. Let's see. Where did I put it? Hold on 1 second, y'all. We're gonna do the APA format. stuff? Like what?
Like what you just passed around.
Oh yeah, no, y'all don't have to write anything for that. I was just showing you that those are some of the studies, the exact studies. I just put some examples, but that had the entire list. So it was just informational. Okay. Yeah, y'all are good. Do y'all have any questions about this slideshow?
No. Is it possible I could get a copy of the paper you're passing around?
Yeah, of course. I can give you some copies. Did you have a question, my friend?
Yeah. Is the slideshow gonna be posted?
I can post it. I sure can. I'll ask Dr. J to post it. I sure will. Y'all have any other questions about it?
I do.
Yeah.
For your study, do you think it was skewed at all by whether or not we have good juvenile rehabilitation programs in where they were working?
I definitely think so. I think it depends on how many years that they worked there. I had one, maybe you guys saw that's only been there for 2 months, and some that have been there for 10 years. You know, it really just depends on how long you've been there, but also, like you said, the programs and their caseload, because some caseloads could have a bunch of kids that had first-degree rape, and then you have some that had traffic violations. So it really just depends on all of those things. But yes, it does depend on the programs as well.
When you did your study, did you account for those outlying factors and stuff, or was it just purely informational study, like a survey?
It was informational, but I have talked to them about the rehabilitation services, and they're very good in Rapides Parish. So what I've seen so far, their doctors and everything else, their medication, everything seems to be working out for them based on the doctors and the program.
So they believe in rehabilitation.
A lot of them did, yes, but some of them did not. Now, there are more probation officers that I didn't get to survey because they didn't fill it out, which is fine. But it is, of course, very, very biased, I would say. So it really just depends on how you look at it and who you study. So. Oh, I'm sorry. Yes, my friend, what's up?
I was gonna say like the crime rate with the A is just interesting to me because I think a lot of older people, like once they get older, then they just like live more dangerously.
Yeah, it is very interesting, isn't it? It is. Because I feel like we already are in that rebellious stage whenever we're younger. It just depends on how far you go with it, and depending on how your lifestyle is and who you're living with and how they raise you. It is very interesting how all those factors come into play.
I would think it would at least like shoot up during teenage years and then shoot up again in like midlife because like that midlife crisis type.
Yeah, that is very interesting that you mentioned that. Does anyone want to add to that? No? Well, it is very interesting that you bring that up because a lot of people in that stage, even in our 20s, I feel like we have such a hard time trying to question everything. Are we going the right career path? Are we doing the right things? Are we saying the right things, you know? And we have that again when we're in our 40s, which is exactly whenever it declines. So it's very interesting you say that. Very good point. Anybody else?
I think genetics plays a lot in that too, because like a lot of families, like addiction runs in their family. So it's like if they do drugs or if it's alcohol or whatever. And it's interesting too because studies have been done where it's been like hereditary for someone to, you know, live in that family and have that addiction, but then they don't have it. Like
It is.
alcoholism, and then some like do. It's like they get one drink when they're younger, and then they just progressively like get worse and worse and worse.
It is. And then, like you said, it kind of just declines sometimes.
And me, I have a thought, like maybe this is just a generalization, but like the more specific you get with the filters that you put on it, I believe that the rates may change because you see in some demographic of people, around 40, they start to drink more, which will cause them to commit more crime. And so that may skew the chart a little bit.
It might, and it depends on your job. Like police officers, you see a lot of them with alcoholism, things of that sort.
Also though, like people who live like more dangerously or whatever, like that I would assume would have a higher crime rate, those people die younger too. So I wonder if it would be more steady if
It very might, yeah. If we had more people, we'd have to have a ratio.